I call the member for Morani.
Madam Deputy Speaker, I rise to speak on the Health and Other Legislation Amendment Bill 2021. I wish to address some of the aspects of the bill that make changes to the Mental Health Act 2016, the MHA, particularly in relation to the treatment of people judged to have impaired decision-making ability. As the Queensland Human Rights Commissioner said in his submission on the bill, involuntary patient admission is a significant limitation on the rights to liberty and security, freedom of movement and privacy, family and home. What the Commissioner's submission makes clear is that people who are made the subject of an involuntary order hold less rights than any other group within the population, including our prisoners. This raises an important point that many people may not be aware of, Madam Deputy Speaker. The vast majority of people subject to involuntary orders in Queensland are people who have committed no crime, have no criminal record and are completely unconnected with the criminal justice system. It is important to keep this in mind when looking after their treatment within the Queensland health system, especially when it comes to the current practice of carrying out electroconvulsive or ETC shock treatment on such people without their fully informed consent. I acknowledge that the bill seeks to address this issue by adding proviso requiring a person's views, wishes and preferences to be taken into account before the approval of ECT treatment is given. However, the wording of this provision is so vague that it offers no real safeguard or protection for such a vulnerable group. And a proper enforcement safeguard is definitely needed, Madam Speaker, when it comes to a procedure which is highly controversial as electroconvulsive therapy, or ECT shock treatment in old terms. During the procedure, the patient is sedated and electrodes are attached to their heads through which an electric current sends pulses through their brain. The treatment causes seizures in the hope that they will somehow alter the brain's chemical makeup. These brain seizures can last up for a minute each time as the shock is administered. According to the UN 2008 resolution on torture and degrading treatments or punishment of persons with disabilities, the practice of ECT may constitute torture or illegal treatment. The resolution also states it is of vital importance that ECT be administered only with free and informed consent of the person concerned, and this consent must include detailed information on its risks, which include heart complications, brain damage, memory loss and, in extreme cases, death. Many medical experts have condemned the use of ECT treatment, particularly on young adults and children, due to its known risks and side effects. A close relative of mine underwent ECT treatment in Queensland some years back, and I witnessed firsthand many adverse effects that he suffered as a consequence, some of which he has never fully recovered from. That's why I feel very strongly that under no circumstances should shock treatments be used on a child. Currently, the Medical Health Review Tribunal can approve the use of ECT for minors without their consent. Ironically, under Clause 22 of the bill, a child is said to have the capacity to consent when it comes to disclosing information if they are of sufficient age and mental and emotional maturity to understand the nature of consenting to the disclosure of confidential information. Elsewhere in the bill, Clause 63B states that the performance of electroconvulsive therapy may be carried out on a minor if the tribunal has approved its use under Section 509. There is no opportunity given to the minor to demonstrate the same capacity for consent given to minors elsewhere in the bill. This means that under the Act, a child of 11 may be judged to have capacity for consent for the purpose of disclosing information, while simultaneously denying a young adult up to the age of 18 no rights whatsoever to withhold their consent to a highly invasive and potentially dangerous medical procedure. I don't see much logic there. It is a contradiction that appears throughout the Queensland health legislation, and it needs to be addressed.
Unlike the member for Morani, I haven't garnered my information from 4chan or some other conspiracy website. I've actually been involved as a nurse in the practice of ECT since the 1980s, not on a frequent basis, but on enough to have somewhat of an understanding of the context of ECT. And it disturbs me greatly when I see depictions of ECT in popular media, which are wildly different to what happens in practice. The member cited some documents there. I suspect, having looked at some other things that he's said in the past, that these documents are of limited evidentiary value from a clinical perspective. But the clinical evidence around the use of ECT is quite clear. Yes, it is controversial. Yes, it is certainly confronting for people to consider this concept. Most of the things we do in health are pretty unpleasant, and the consent around them is extremely important and is fundamental to healthcare professionals. And when a person is incapable or unable to consent, the protections around that are immense. And one of the most important protections is the ethics and the professionalism of the healthcare professionals involved in the practice. It really disturbs me because when I hear the member from Moroney talking, it's like there's this great conspiracy going on where nurses and doctors and allied health professionals are standing around, having a patient come in who's unable to consent and going, "Oh, great, what can we get away with this person?" I've been there when a patient has come in from a road accident, unconscious, multi-systems trauma, and we can't seek consent from that person. We probably can't seek consent from anybody around that person. But we know what that person needs, and we're not conspiring against that person. I want to tell the member from Moroney, and I want to tell everybody in the community clearly, I want to tell them clearly there is a conspiracy going on in healthcare. We've been at it for thousands and thousands of years. We've been conspiring to make people live longer. We've been conspiring to try and stop people living with pain. We've been conspiring to try and cure all forms of maladies that afflict the human. And it's a conspiracy I'm going to continue to be a part of. Trust me. On the occasions where I've been involved in the practices of ECT, and I've been in the theatre as well as caring for patients on both sides of that procedure, the outcomes that I have seen match what I have seen in the literature around the effectiveness of the treatment. I have literally seen people that were completely and utterly catatonic, completely and utterly unable to move their legs, their arms, get out of bed, go through one session of ECT and regain full use of their body, and in 2 sessions of ECT be well enough to be discharged into the community. Now, if we're going to deny people the opportunity to have treatments that we know work, we may not know how they work, and that's not uncommon in healthcare either. We don't know how Panadol works, but I'm sure you've all taken one. So I think this notion that we need to be placing ECT in different categories to whatever else we do in healthcare is wrong, and it's ridiculous. We treat every single procedure that we do in healthcare with the utmost care and attention. Now, it doesn't mean that procedures can't damage you. It doesn't mean that we don't get things wrong. It doesn't mean that people intentionally set out to do the wrong things, but more frequently just do the wrong thing through human error. Of course all of that happens, and of course it's terrible and it's tragic when those things happen. But the vast majority of people that undergo ECT receive good outcomes, and it makes a difference to their life.